Good afternoon, everyone, and good morning to our friends on the West Coast. My name is Drew Voitel, and I am the Senior Project Associate for Education and Outreach at CAQH Core. It is my pleasure to welcome you today to our webinar on voluntary core certification with Texas Medicaid. Before we begin, I would like to mention a few logistical items. You can download a copy of today's presentation from the CAQH.org website. Navigate to the core pull-down menu at the top of the CAQH.org welcome screen and select the Core Education Events page. The link to the PDF version of the presentation can be found under the listing for today's webinar. Also, a copy of the slides as well as the webinar recording will be emailed to all attendees and registrants in the next 1 to 2 business days. We will save time at the end of today's program to respond to audience questions. You are encouraged to submit your questions at any time during the webinar by typing them into the questions panel on your dashboard. We do ask that when you submit your question, please identify the type of organization you are with so that we can give you a more applicable response. We would like to thank our 4 guest presenters for joining us today. We have Tabitha Harbers, Mark Meisterschlager, and Mayank Shah, all from Accenture, as well as Marty Coleman, who is with the Texas Health and Human Services Commission. I will formally introduce them a little later, but I wanted to extend our appreciation to all of them for joining us today. Our session today will start with a background of voluntary core certification, and then we'll move into a profile of Medicaid in Texas, followed by a dialogue with our 4 guest presenters. We will then discuss the different resources CAQH Core offers on core certification, and finally we will end with an audience Q&A. But first, to start us off today with the background of voluntary core certification, we have CAQH Core Associate Director Robert Bowman. Bob, go ahead.
Great, thank you, Drew. And just as Drew mentioned, we do want to provide you with some background on voluntary core certification. And this is a industry-wide program, really kind of one of a kind, and really does establish the gold standard for certification on the operating roles. It is developed by the industry for the industry, and that even includes the requirements. Beginning way back at the beginning, we ensure that any sort of requirements that become part of the operating rules are developed by the core body. And that core body includes a multi-stakeholder industry representatives that have very transparent, open discussions, and they ensure that all of the requirements are well vetted. Part of those requirements do include certification requirements. And the certification testing really is part of a conformance testing process that is conducted by a third party. That third party is an expert in EDI and testing, and they ensure that, and actually CAQH Core ensures, and we authorize those testing vendors to offer core certification testing. The role that Core also plays in that process is really as a neutral administrator for the paper process, the application process that entities go through. So not only do we authorize the conformance testing vendors, we also review and approve any sort of certification application that may come in from any of the testing entities. And on the next slide, you'll see some of the benefits that core certification can have for those 4 main category types of stakeholders, from health plans to providers to clearinghouses to vendor solutions. Each one of those stakeholder types has very specific benefits that voluntary core certification can demonstrate. From health plans demonstrating conformance for the federally mandated operating rules, to providers eliminating time-consuming calls and paperwork and increasing patient satisfaction, to clearinghouses and vendors that are really see this as a value add for their current customers as well as a way to attract new customers. So as you can see, voluntary core certification is really attractive to all the different stakeholder groups that it's applicable to. On the next slide, you'll see that, and we're really happy to announce, we now have 310 certifications have been awarded since we've started the certification program. We do want to highlight the Medicaid certifications. Texas has achieved phase 1, 2, and 3 certification. MaineCare has added to their 1 and 2 by completing phase 3, and New Hampshire Medicaid has completed phases 1 and 2. These are all our most recent Medicaid certifications. Other certifications that are really important that have just recently completed as well include Boston Medical Center Health Net Plan, the Cooperative Managed Care Services, eligible phases 1 through 3 in one fell swoop. HIPAA Suite in phase 3, and Aetna just completed phase 3 certification as well. So another national payer there, seeing that voluntary certification for phase 3 was really important for them too, so they achieved that certification just recently. We do want to highlight the fact that on the next slide, phase 4 certification is now available and is ready to go. This does allow organizations to complete certification testing for the phase 4 rule set. And the phase 4 rule set does include 5 operating rules, all infrastructure-based for the healthcare claim, the prior authorization, the benefit enrollment and maintenance transaction, as well as the premium payment transaction. So the other 4 transactions that are part of the HIPAA mandated transactions are now also available for voluntary course certification. Again, this does allow you to publicly demonstrate your commitment to administrative simplification, and it does build on the work that you've already done for phases 1, 2, and 3. Again, it just builds on and adds these other transactions to that infrastructure. We do also want to highlight on the next slide some recent progress that we've done on our market research, our market reach report. This is a way for us to demonstrate and share with the industry all of the entities that have completed voluntary certification. What does that mean for the market? And we have completed part 1, and this includes the health plans, looking at the number of covered lives benefiting from course certification. Part 2 we're working on now, and this includes the providers and what type of information and how they are being impacted by the voluntary certification. Today we're glad to and happy to report that for course certified health plans, they cover approximately 64% of the total U.S. insured lives. So specifically for phases 1 and 2, that's 76% of the commercially insured and 44% of the publicly insured lives. So a huge impact for eligibility and claim status transactions. Now with phase 3, which includes the EFT and the 835 or the remittance advice, it is lagging. Again, that is the most recent other than phase 4 certifications that are out there, and plans are really picking up momentum for phase 3 right now, as demonstrated by Texas Medicaid this afternoon. And it's at 27%. So we're really looking to hope to boost that up through the course of the year, as well as reach into the phase 4 transaction. If we move on to the next slide, you'll see some of the key benefits for Medicaid as they pursue voluntary certification. It does position the Medicaid as a leader in administrative efficiencies. It ensures real-time access to eligibility information for Medicaid beneficiaries. It allows hospitals and doctors to improve the revenue cycle by standardizing claim adjustment code combinations and making it easier to post payments via the EFT. So you can auto-post through a remittance device and auto-post EFT for phase 3. So it does lower the cost for claims processing systems. Helps also reduce the cumbersome of paper checks and paper check processing. It enhances opportunities for interoperability between providers and Medicaids. Many times providers Medicaids have been laggards in the field for automation, and this really allows Medicaids to pursue those types of interactions with providers. So it helps improve those relationships, especially with large hospital systems, large providers that really do support Medicaids across the country. And last but not least, it does give assurance that the state Medicaid is in conformance with the federally mandated operating rules as well. We do have an interactive map on the next slide that is also available on our website, so you can see exactly which states, highlighted in purple here, have at least one Medicaid entity that is course certified. And that may include the state Medicaid agency or its vendor, or any sort of any sort of county Medicaid agency or managed care agency that supports Medicare or Medicaid. I'm sorry about that. Last but not least, the voluntary course certification unique considerations for Medicaid. These are things to consider as Medicaids wish to pursue voluntary course certification. You would want to ensure that you're coordinating with the state or federal agencies, ensuring you're working with your Treasury Department, for example, for the EFT operating rules. It does go into benefit level eligibility, so it's very specific with Medicaid on exactly what types of services that the Medicaid recipients are eligible for. there is a determination for testbed data. The testbed data that's available for certification testing, it's basically it's very specific, and you have to make sure that you can incorporate that into your own systems as you pursue certification testing. You want to search for innovation efficiency opportunities to improve the program overall. There's lots of ways to do that with, particularly with claim status and the 835 or the remittance advice transaction. Lots of coordination may be necessary if you have vendors in your space or in your state. The opportunities to coordinate and even pool resources with other state or local Medicaids, especially if you have a diffuse system within your state. You may have several different agencies that you have to coordinate with, or several different vendors that you may have to coordinate with. The core application fee is waived for all federal, state, and county government entities. So basically it's free certification, and it's also free to test. So it's free testing, and the certification seal is free for federal, state, and county government entities. And patient financial responsibility, such as copay, is also something that may or may not be applicable, but if it is applicable, it's something that you want to plan for as well. And with that, I'll hand the call back over to Drew for our first polling question.
Great. Thank you so much, Bob. That was great information. And this brings us to our first of 3 polling questions that we'll have for you, our audience. And these are interactive, and you'll see the window pop up on your screen for you to answer. And this question asks, do you anticipate your organization will become core certified in 2017? And let me go ahead and launch this poll. And you should see it pop up on your screen. And the reason we ask this is we'd like to take a pulse of those in our audience to see where they are at and where their thinking is when it comes to possibly pursuing voluntary core certification. So we'll just take a couple seconds here. And Bob, I might just have you quickly comment on the results here before I show them to the audience, and before we move into our guest presentation here. So just a couple more seconds, and I'll show the results here. We got about 63% in as voted. So I will close the poll and share the results. And so, Bob, it looks like 53%, the majority here, are unsure. And I imagine there's a lot of uncertainty just generally in healthcare right now, so maybe that's not too odd to see here. The following is 20% as not applicable or already certified. We've lumped them together. 16% is saying no, 10% saying yes, phases 1, 2, or 3, and then 2% saying yes, phase 4. What basically this uncertainty? What do you make of these results?
So you bring up a good point, Drew. And I think that with those that are in this bucket of uncertainty, hopefully today's presentation might help persuade you one way or the other, because you'll definitely hear from Texas Medicaid on how they've gone through that process and what kind of efficiencies that they're seeing. Even if it's just internal within a network or a system themselves, versus also what the providers may benefit from within the state, at a state level. So hopefully we can persuade some of the unsures or show you what kind of resources we have available that might help. And it's also good to see that there are still entities out there that are on the call today that are going to be pursuing phase 1, 2, 3, or 4 certification. So again, if you have any questions along the way, make sure you reach out to us. We can help you.
Yeah, absolutely. This will be great information for those that are unsure, and hopefully reconfirm some things that people know who answered a yes to this question. So I'll go ahead and hide that. And we'll move on to our next presentation with a profile of Texas Medicaid with our guest presenters. And so it'll be my pleasure to introduce our speakers from Accenture. So first we have Tabitha Harbers. Tabitha is currently a delivery manager with Accenture Health and Public Service, working on the Texas Medicaid claims processing and administration contract. Tabitha leads large projects focused primarily on long-term care and EDI. Tabitha has been with Accenture for over 13 years and has more than 16 years of experience with Texas Medicaid. She served as the project manager for the implementation of core operating rules and core certification for phase 1, 2, and 3. And joining Tabitha during the dialogue portion is Mark Meisitschlager. Mark is currently a business solutions architect with Accenture Health and Public Service, working on the Texas Medicaid claims processing and administration contract. Mark develops business and technical solutions focused primarily on EDI. Mark has 17 years of experience with Texas Medicaid, the last 13 years being with Accenture, and has more than 25 years of insurance experience overall. He served as a solution architect and lead analyst for the the implementation of core operating rules and core certification for phase 1, 2, 3, and is currently working on the implementation of phase 4. And our third guest from Accenture is Mayank Shah. Mayank serves as Technology Delivery Manager on multiple large change order requests for Texas Medicaid claims processing and administrator clients of Accenture Health and Public Service. Mayank has been with Texas Medicaid and Accenture for over 10 years, and he specializes in implementation and delivery of solutions involving X12, HL7, and other health IT transactions. He served as technical architect during the core operating rules phase 1, 2, 3, and 4 implementation. And our fourth guest, last but certainly not least, from the Texas Health and Human Service Commission is Marty Coleman. Marty has worked in operations management with HHSC for 8 years, and as one of HHSC's stakeholders, coordinates closely with Accenture on a variety of projects. Marty has experience in both the public and private healthcare sectors. A wonderful panel we've got here today, and so thank you all again for joining us. And Tabitha, we'll start with you.
Thank you, Drew. So we can move on to the first slide of our presentation.
Let me pull this poll up. Hold on one second.
And as Drew is doing that, I just wanted to give an overview of what our presentation entails today. We wanted to take the opportunity to share with everyone a little bit about how Texas Medicaid is structured in terms of our Medicaid population and the client and provider population that we serve. And then we wanted to highlight the volume of transactions that we process, those specifically that were impacted by core operating rules, and then give a little bit of an overview of our implementation timeline and some of the pros and cons of our core certification process. So on the first slide here is a breakdown of the number of providers and covered lives or enrolled clients that we serve here in Texas Medicaid. For fee-for-service Medicaid, we serve 273,716 Texas provider identifiers, and those are linked to over 102,000 national provider identifiers. We then break out our line of business into long-term care, and we cover 5,352 MPIs that are specific to our long-term care line of business. From a client perspective, combined, we cover over 4 million combined fee-for-service and managed care clients, with about 3.8 million of those being specific to managed care. And then again, similar to the provider area, our long-term care clients are also a subset of that 4 million, and that we have 265,000 that also have long-term care active service authorizations. And then we have another smaller category specifically to those children with special health care needs. So next slide, please. So primarily for core operating rules, we were impacted by the eligibility transactions, remittance transactions, and our response transactions. So you'll see the breakdown here of the volume that we process on an annual basis. This is sort of an average of the last couple of years that we went back and looked at data for. So specifically for fee-for-service, we process over 3 billion, I always have to count the commas, fee-for-service batch transactions. And then you'll see we also have real-time transactions broken out there. And then it goes then to demonstrate what we do for our long-term care line of business in both batch and real-time. And then for our 835 transactions for fee-for-service, they're about 468,000 annually. And then for the, I'm sorry, that should be long-term care on the next slide, 147,000 for our long-term care population. And then finally, our 276 and 277, as you can see from our data here, this is primarily our fee-for-service population, and it's roughly close to 5 million transactions that we do here. Next slide, please. So I think one of the challenges that we had was that, or I wouldn't say a challenge, but unique to our approach, is that we've implemented all phases of operating rules with a single project that we spread across multiple deployments or multiple phases. And they were broken down here between December of 2013 through December of 2014, and primarily by system that was impacted and then by obviously like rules within the core operating rules. One of the unique things about our implementation was that it was not limited solely to EDI transactions, but we have a number of user interfaces that we had to change, both the front end and the back end, to support the core operating rules. And we've just wrapped up the majority of the Phase 4 implementation of operating rules, and our core certification activities for that phase are in process. Next slide, please. So our key testing dates specific to core certification, we began our pre-testing activities in the March to April timeframe of 2015. So if you think back to the slide that we just presented, we did this after we completed the implementation of core operating rules. And we're going to talk a little bit about what that meant for us in just a few minutes. Test execution activities with EdFX took place between October of 2015 through December of 2015, so about 2 months of activity there. And then we submitted our core pledge in October of 2015, and we received our seal of core certification in January of 2016. Next slide. So just some of the lessons learned that we wanted to touch on with regards to our core certification process. The first one here is sort of a big one for us, and that is thinking about core operating rules as HIPAA plus. And we say that because first and foremost, you have to ensure your overall HIPAA compliance in order to be really successful with the implementation of core operating rules and to get through the core certification process. Also, wherever possible, use the core certification test suite early on in your processes to help you identify any potential gaps with your solution that could potentially impact your core certification process. And then to piggyback on that, integrate the product and certification testing whenever you can. So we recommend that maybe you consider integrating this into your product test activities before you ever deploy your changes, whereas we did it after the fact, and we did have to go back and rethink some of our solutions that we maybe could have avoided had we done it just a little bit earlier in the process. And then also, with regards to core certification activities, we highly recommend that you focus and prioritize your connectivity and data content rules first. These were the places that we probably saw the majority of our challenges as we were going through the process. And so given that fact, we just recommend that folks consider doing this early on in the process. And then one of the other items that we wanted to touch on today was it was really, really beneficial to us in our organization to keep CAQH Core engaged during our core certification process. They were very helpful in sometimes working through questions or challenges that we were having with our core certification in interpretation of the rules, specifically as we were working with the testing vendor. And then finally here, is test as many business scenarios as you think are practical or that you can allow for in your testing timeline. And for example here, when we think of something such as normalization, for example, 1 or 2 business scenarios will pass the core certification test, but there are many, many variations of how you can do the normalization. And so it's important that you try to get as many of those combinations in so that you don't encounter any issues later on in the process. So those are some of the key things that we wanted to touch on today, and we can go into more detail on any of these items as we go through more of the panel of questions.
Great. Thank you so much, Tabitha. That was it was really good information, particularly the lessons learned portion you had there. And so now I will, to facilitate the dialogue portion of the webinar, I'm going to hand things over to my colleague, Jessica Porras. Jessica?
Thank you, Drew. So this is Jessica Porras, and I'm a Senior Manager for Education and Outreach for CAQH Core, and I'm happy to be doing this more of an internal conversation with our speakers from Texas Medicaid and Accenture, as well as from CAQH Core. So why don't we get started? This is a question for our 4 speakers from Texas Medicaid. So why did Texas Medicaid choose to certify for, phases 1 through 3 and now working through phase 4?
So this is Tabitha. I'm going to go ahead and answer the first portion of this question, and then I'll ask Mark and Mayank to chime in. So primarily, one of the drivers that we had for implementing core operating rules and pursuing core certification was that in addition to this, we currently are a CMMI 4 certified organization, and so this core certification just helps us to, it just continues to work in line with our commitment to complying with industry standards, including CMMI, HIPAA, ACA, and so on and so forth. We also feel strongly that it helps to provide some teeth, so to speak, to enforce compliance with our transaction designs when we are working with external trading partners. So it helps us in our position to say we are core certified and compliant with core operating rules when we encounter a situation where someone might question our implementation solution. Mark or Mayank, do you have anything to add to that?
I do. I would say that, in addition to the technical aspects of it, being compliant also means that we feel more comfortable with our transaction responses. So if we're not only HIPAA compliant, but if we are responding in a way that's CAQH core operating rule compliant, it gives us more confidence that we're providing responses to our submitters in a way that's consistent with the rest of the industry.
So that's incredibly interesting and well said, from both of you. So my follow-up question for Bob is, is what we're hearing from Texas Medicaid consistent with what you've heard from other Medicaid entities that are choosing or in the process of core certifying?
I think it definitely is very consistent with what we've heard from many of the other state agencies as well as their vendors as they've gone through certification. Some of the lessons learned and challenges that they face, and from the get-go too. I think it was insightful from what Tabitha said about ensuring that you consider data content. Many Medicaids may not consider that the data content rules are directly applicable, or what does this mean about, we may not have deductibles, we don't have these types of patient financial requirements, but some Medicaids do. Some do have $1, $2, $3, $5 copays, and those also have to be considered. So some of those things, we don't want you to be surprised by those requirements. So again, Tabitha, Mark mentioned, the assessments are really helpful. Start those earlier rather than later. That's things that we've heard definitely from other Medicaids that prove to be quite helpful for them.
Thank you, Bob. So back a couple more questions for Texas Medicaid. Tabitha, you gave us a very nice overview of the Texas Medicaid program, but I'd like to delve into that a tiny bit by, what are the unique features and pain points of the Texas Medicaid program for all of you, all the speakers from Texas Medicaid?
I think for the most part, I touched on some of them, but like you said, probably want to just give a little bit more information. So specifically, the reason that I pointed out that we split our population across fee-for-service, Medicaid, managed care with long-term care is that to support that, we also have 2 claims processing systems to do that. And so we had the 2 systems that we had to work with in order to implement core operating rules and core certification. So the way that we process claims through both of those systems is very different, and so essentially we had to think through 2 different unique implementations of the rules. Also, just the sheer volume of covered lives and the number of transactions that we process through our system. And as I mentioned previously, we are not just supporting a line of business that is direct EDI or X12 transactions. We also have user interfaces that we offer as options to our provider and client community that we had to ensure compliance with as well. And then we also have external trading partners that we had to align with in order to implement core operating rules. So for the fee-for-service line of business, we are specifically the claims administrator, the, what's the word I'm looking for? Yes, the fiscal agent for, but for long-term care, we actually submit a pay file to a fiscal agent who then processes. So we had to be ensure that they were core compliant, and then also the comptroller for the state of Texas as well. Mark and Mike, can you think of anything else?
Like mentioned earlier by Tabitha, one of the unique features of Texas Medicaid is also the sheer amount of volume that flows through our doorsteps. We saw some numbers in one of the earlier slides. Numbers like 4 billion, 5 million, 4 million sometimes make it very difficult and challenging to ensure we are compliant on every aspect of core operating rules on top of being HIPAA compliant. So those are some of the things we had to work through, not just for core certification, but during various other implementations at Texas Medicaid.
I would add to that, we have not just X12 transactions that are impacted by the compliance, by the changes that we made, but we also have user interface that represents that data outward to some of our clients that aren't exchanging X12s directly with us. So there was lots of adjustment and change needed for us to correctly be able to represent that data back out to our submitters using those portals.
Well, what you're describing is really remarkable, and I just think it's amazing that you keep saying millions and billions. Mm-hmm. In this relationship between the program and the fiscal agent, so tell me a little bit about the partnership between Accenture and the Texas Health and Human Services Commission's Medicaid office.
So as I mentioned earlier, we function as the claims administrator for the Medicaid program here in Texas, and for fee-for-service, we actually process the claims here, whereas we do the adjudication for the long-term care claims. Under this contract, we are also responsible for business operations. So we do provider enrollment for fee-for-service Medicaid providers. We also man the call centers for the Medicaid recipients across the state of Texas for both fee-for-service and for long-term care. And let's see, what else? I think I've pretty much covered all of the major functions that we do here on this particular contract.
That's very helpful to know, and there are probably a lot of, of our audience members out there from other Medicaid programs that have, kind of similar partnerships, so this is helpful. So given the scale of this program, when you were implementing the operating rules, how did you keep the communication flowing with your providers to ensure they knew what they needed to do and the benefits they would be receiving from Texas Medicaid? For example, the less than 20-second response time when requesting eligibility information.
So we handle that. I'm sorry. We handle that in a couple of ways. So we have a number of existing venues that we leveraged. For example, monthly scan calls with our managed care partners, and we have various provider associations and hospital associations that we are active participants in. And then we leveraged our Texas Healthcare Partnership website to communicate information. But then specific to this project, we developed a communication plan and had scheduled communications that were distributed to our impacted providers through the duration of our project.
That's great. So you had mentioned earlier during the presentation some of the lessons learned that you shared with the audience, but I'm curious if there's anything more you'd like to say about the challenges or lessons learned during the core certification experience that you think others might find helpful.
Sure. I think primarily for us it was identifying test criteria earlier on in the process. I think, looking at just the core rules and trying to identify the changes isn't really enough. I think it's important to look at those test scenarios and start identifying gaps using the test suite wherever possible. And I know Tabitha mentioned that earlier in the process, but that's a great utility to be able to compare your solutions to what the actual core rules entail.
So I don't want to interrupt.
No.
So I wanted to ask Bob, given these challenges that we've heard, are these the types of things that you've heard from other entities, and are there ways that we can kind of preempt these issues from coming up, or things that we can say to help some of our audience members?
Definitely. I think that Mark brought up a point about looking at the core rule requirements and what the test cases and test scenarios are prior to actually going in and conducting them. Part of that is completing your gap analysis as early in the process as possible. And we'll see this in a few moments, but we do have some tools available in an analysis and planning guide that allows you to map out exactly what your system is today versus what the requirement is, so you can get that gap, and you can then build a mitigation plan, a system mitigation, typical SDLC kind of process around making those required changes, going through the required testing for the system before you set up your profile and begin your core voluntary certification testing. So that entire kind of project life cycle process can be really helpful in identifying those specific requirements that core requires that might impact you either at a system level or even sometimes at a business level. Sometimes you may have to make a change to how your telephone representatives may respond to something because your provider is calling in for questions about real-time processing, and they need to be able to inform the provider just as much as the provider may need to know about how to access that data in real time. So those types of assessments and gap analysis and the planning tool is really helpful. I think Mark made a great point there.
Thank you, Bob, for that. And, Bob, you're going to be kind of walking us through a little bit of that in a few minutes, so that's great. And I want to end this dialogue portion with one last question for our colleagues with Texas Medicaid. So it's been a little bit, about a year since you got your phase 1 through 3 certification seal. So have you been seeing any benefits from the certification or the operating rule implementation itself?
I think going back to what we talked about before, it has helped us in our communication with our external trading partners to reassure them of our solutions and the way that our transactions are designed to support the various business processes. And then we've also implemented some internal mechanisms to ensure that we continue to maintain our compliance. So, for example, we have implemented a process by which any system change that occurs after we completed core certification must go through a survey that ensures that they're not undoing anything that we've done specifically to support core operating rules or core certification. So that's just sort of a fail-safe for us to ensure that at any time, we feel confident that we're still meeting the requirements of the rules in our certification. And Mike's going to talk a little bit about some of the benefits of new tools and performance improvements and such.
As we embarked on the journey of core operating rules, we realized that there are certain changes needed within our systems, and we were forced to look at it from an end user perspective or end trading partner entity perspective, while keeping still our client and provider-centric business in mind. Hence, we had to prioritize certain sub-processes within our organization, whereas make certain processes a little less critical in order to comply with some of the response timing criteria, in order to comply with some of the content that goes out in responses that we send out. Sometimes when we do try to implement solutions, and if we didn't really have core operating rules, we always had to think about what are the options HIPAA lays out for us. And sometimes HIPAA tends to be a little bit more generalistic, has quite a few ways in which you can do certain things, whereas core operating rules puts a little bit of more guidance on top of it, which allows you to communicate with your end entity in a one common single language, prioritizing what they want to see first in order to conduct their business successfully and overall increase the client satisfaction for the entire state of Texas. So these are some of the things we saw during the implementation itself, and as we are sitting now 1 year into the process, our production system is kind of reinforcing our observations.
I would add as well, I'm sorry, I didn't mean to interrupt.
No, go ahead.
Having the additional standard of the core operating rules is really important to us as well. I think prior to implementing core operating rules, we were sort of limited in our ability just to look at what the HIPAA standard was. This value is valid or not valid versus core operating rules, which really take the perspective of the information receiver and give us more business perspective in the types of solutions we implement going forward.
That is really gratifying to hear, and it's great to hear all of these benefits that you're seeing. Well, I want to thank our colleagues from Texas Medicaid, Tabitha, Mark, Mayank, and Marty for taking some time to talk to us today. And next, I will send it back to Drew for our second polling question.
Great. Thank you, Jessica, and thank you, everyone on the panel. That was wonderful to listen to. And this next audience poll question asks, which benefit of core certification is most important to your organization? This question is for implementers. We heard a little bit about what's going on with Texas Medicaid, but from your perspective, what are you seeing as the biggest benefits from core certification? And so we'll take just a couple seconds here to respond, just like last time, and maybe Bob or anyone else who'd like to chime in might just get some perspective on the results that we see here in just a couple seconds. We'll take maybe about 10 more seconds. Close the poll here. We have about 35% voted, but we only have 89 people on the call today, and this is, of course, only for implementers. So let me close the poll and share the results. And so it looks like 37% saying that this ensures my business partner or fiscal agents are functioning as efficiently as possible. And then we have 33% explaining that it improves business processes, leading to greater efficiencies for our customers. For example, requires real-time patient financials for providers. And 23% saying demonstrates conformance with the operating rules. Results speak for themselves, but Bob, do you have any perspective here that you'd like to share?
I think that, definitely. I think that one of the goals of the core operating rules is to ensure that every link in the chain, from the provider through their vendor, through the clearinghouse to the health plan, and back through, are core certified, so that the provider, and this is the Mark said I think is really important, that the receiver of the transaction has a business perspective and actually a business function that they're trying to achieve. And through each of those 4 steps and back to the provider, when the provider submits to the health plan responds back with that data to the provider, they're trying to complete that business function. So the ensuring that the business partners are functioning efficiently is really, really key to that process. And all 4 stakeholder types is really, really important for that provider to kind of receive and reap the benefits of the transaction. So it is probably a burden. There's lots of requirements on the health plans and the vendors and the clearinghouses, but it's all for that business impact to the provider to ensure that they can get the data that they need in a timely fashion to perform those business functions. And that's really helps the provider too. I mean, sorry, really helps the health plan too, because then the provider has satisfied, the provider has the information, the provider can bill a clean claim so it doesn't get hung up at the health plan, that kind of thing. It all kind of feeds into each other.
Great, thank you, Bob. And moving on to the last section we have here is Bob, and he's going to talk a little bit about some of the different resources available for voluntary core certification. So Bob, take it away.
Great. And just as Drew said, we do want to share with some of the resources that we have to support voluntary core certification. And these resources are found on our website, and they're all free and available to anyone that wishes to click on the website. And you can go to them directly from the core certification website page. And from there, it'll drill down into very specific tools and resources that we have. Beginning with the 4-component process, you can navigate to this page, and it walks through each of the 4 steps that you need to complete for voluntary core certification. Kind of beginning with doing that pre-certification assessment and that system evaluation, part of that gap analysis. That's real part of project management 101. See where your system is today and where it has to go to ensure you're in compliance and in conformance with the operating rules. Down to signing the pledge, going through the testing, and then going through kind of I mentioned it earlier, the paperwork process to ensure that you actually can apply for the seal and go through that. On the next slide, we do have an e-learning tool available as well. You can click directly on the slide here. It's also available on our website. It just walks through in just a few minutes exactly what each of those 4 steps are, the different subsets that need to be taken or should be considered as you go through voluntary core certification. So it's just a helpful tool so you can ensure that you know all the steps that you need to do. And it's also handy to use this as a resource if you're trying to get the project approved through your management, through finance. They can see the soup to nuts exactly what's required for certification and why you might be pursuing it, and kind of seeing who else is in that same bucket of you of going through that process. Something that's really important on the next page is that core analysis and planning guide. And we do have a guide for every phase. So for phase 1, 2, 3, and 4, there's a separate guide. And that guide does have different tools in it so that you can ensure that not only can you do a quick assessment, does this general rule apply, yes or no? We don't do batch transactions. We only do real-time transactions for eligibility, for example. So you know that you won't need any of the batch rules at all because you can do those high-level assessments. It also has a tool very, very detailed down to individual rule requirements. It's 100 lines in a spreadsheet, but it really allows you to check it off. Does it apply? Does it not apply? Is it a business impact? Is it a technical impact? Is it both? And then how do you remediate that? Is it a system change, a software program change? Is it a business process change? Does this require education for other business units? Do we have to involve a communication plan for providers? A great component that Tabitha brought up. Sometimes you may have to communicate these changes that you're making to your provider community. So it helps you identify those types of touch points within your system as well as your business process. On the next slide, you also see that we have a whole host of FAQs. We actually have several hundred FAQs for each rule. And these are questions that submitters sent to us as people were going through the certification process. They would submit questions to our email inbox, and then we would convert them, and we do convert them, into formal FAQs. And because Medicaid, we would have questions, we'd have calls, we'd walk them through some of the requirements, and those would all feed into this process of developing an FAQ. So if you sent an email into this, you'll probably see it as an FAQ. So again, these are real-world examples of questions that came up, interpretation questions for the requirements or assessments that were sent in, and we converted those into a handy FAQ, and it's all broken down by rule and by section of the rule, so you know exactly what the topic is and can drill down pretty quickly. And there's a great search function too that's now available on the website for the FAQs. You can put in a few key terms, and it will help you find those questions. On the next slide, we have also implemented, since we're all about efficiency and real-time transactions, getting people off of paper and manual processes, we've also converted our paper application process. If you download PDF, fill it out, then fax it or scan it and email it to us, you don't have to worry about that anymore. We do have an online application portal. Not only does it allow you to submit all the required documentation electronically and complete it electronically, It also tracks the status, so you know exactly where it's at within the pipeline as it goes through the different approval process, and you know exactly where it's at. So that application portal is all online. It's a great tool and resource for you. And last but not least, as we mentioned several times now, we do have resources available. If you ever have questions, you need help, you can feel free to reach out and contact us. Here's our email address. We'll set up conference calls with you, with your system developers. We'll set up three-way calls with EdFX representatives if it's a particular test script that you're having problems with. The three of us can get on a call together. We'll help you go through this process and answer any question that you might have. And I know, for example, we did this with Texas. Texas had Mark had a couple questions. We jumped on a call and make sure we can address those right away. So hopefully they found it helpful, and hopefully you can too. So again, if you have any questions along the way, just let us know. And with that, I'll hand the call back over to Drew for our last polling question.
Great. Thank you so much, Bob. And our last polling question of the webinar will be the same. I will read the question and open the poll, and we'll do this one quickly here. This question asks, if you are with a Medicaid agency, what barriers do you face when working to implement the operating rules or pursue voluntary core certification? So we'll launch this poll and pause just a second. And the reason, and Jessica, maybe you could provide some input here. We're always looking to find new ways to provide resources and learning tools and opportunities to help clarify anything that there might be confusion out there in our stakeholder audience. So that's why we sort of ask these questions. Any way that we can help you, our audience, is really why we ask this question. We'll take just a couple more seconds here, and I'll share the results before we jump into the audience Q&A portion. And this one is a select all that applies. So there might be more than one, and very often there usually is. So we'll take just a couple more seconds. Try and get a few more people to vote here. Five more seconds, and then I'll close the poll. All right. In the interest of time, I'll close the poll and share the results here so we can see just how people have responded. It looks like, let me see here, so about 53% competing initiatives, obviously very busy, lots going on, particularly in the Medicaid world. 41% saying cost. Obviously, that cost is always a huge factor. 53% again, limited IT or business resources. 24% indicating other, and then 12% indicating executive approval. And I'll just say that if you ever have any questions, please let us know. Feel free to contact us at any time. And if you did answer other, let us know in the post-webinar survey just so we can reach out and work with you if you would like that. So I will hide the results here. Let me see if GoToWebinar will allow me. Okay. And now we will move into the Q&A portion. And so here is the Q&A section. I'll be fielding the questions that come in from the audience. And so let's jump right into it with the last few 6 minutes we have here. And so this one, maybe Bob, you can help answer. And this is pretty broad. This question asks, can we certify for any phase, or does it need to happen in order?
That's a great question. And for health plans, it really is set up to go in order from phase 1 to 2 to 3 to 4, because the requirements build one off of the other for all intents and purposes, especially when it comes to the infrastructure that you're building. It's great to kind of piece that off and your 27X transactions, the eligibility and claim status. Then you move into usually a completely different system, and even IT resources when you talk about phase 3 for the 835 and the EFT. That's usually completely divided within a health plan. So they're set up to go 1, 2, 3. Now, some considerations are made for software vendors. They may not have an eligibility or a claim status product. They only focus on payment, so they may only have a product that offers phase 3. So vendors can go and jump around depending upon what kind of software they have, what kind of package that they're marketing, what kind of transactions they support. So there's a variance and there's a difference. And the assessments tools can help you identify which is which and which path you should go down.
Great. That was very helpful information. And this next question, I think maybe I'll throw it back to you, Bob, but if our Texas friends want to jump in, please feel free to do that. And this question comes from a Medicaid entity in California. And this question asks, have trading partners increased their use of the EDI transaction versus other methods since you've become certified? Maybe that's more for our Texas friends, but anyone feel free to tackle that one.
Maybe let me jump in and just give a quick overview. CAQH core explorations have recently published our 2016 index at the beginning of February, so it's relatively new, and it is a complete assessment of over 5 billion transactions that were conducted in the entire country of what really tracking exactly what between a manual transaction the provider may do from a phone call or a fax to an electronic EDI transaction, from a portal to a true EDI 837 or a 270-271 eligibility verification check. And it tracks those, and it's been tracking them for several years. And we did see upticks in all of the electronic transactions. Some were a little more modest than others. For example, payment and remittance advice had limited or smaller upticks year over year than eligibility or claims. Claims were really tracking in the mid-90% for the 835, and the remittance were hovering around 50%. So although there are upticks, there's still big strides that can be made for providers adopting the electronic transactions, electronic versions of electronic remittance advice, or a paper remittance advice, or a paper check versus an EFT transaction. I don't know very many employers that actually pay people with a paper check anymore, but health plans and providers love their paper checks. So that's another way that we've seen upticks from year over year in adopting the transactions. Not as great as they can be and perhaps should be for all the transactions, from claims being 90% to remits being 50%. But there have been significant increases.
Great. And Tabitha or Mark or Mayank, do you have any follow-up?
On our end, we did see a minor increase in adoption of electronic transactions within our provider and trading partner community. Fortunately, we already had vendors and providers who were doing a lot of X12 transactions with us in a variety of ways. They may be staying true to the HIPAA rules and the X12 rules for a given transaction, not necessarily to transmissions and the way of interaction, which is kind of an added benefit that CAQH, via core operating rules, streamlined. So we did see a minor increase, and we saw options getting available for others to streamline the communication with us via standard and more enhanced security protocols.
And I would add to that. I would say that we're completely sold on the idea that as more plans become compliant and follow that particular standard, there's more of an incentive for the providers to, take advantage of these electronic transactions.
That's great. That's great information shared by you two and Bob as well. And I see that we're bumping up against the top of the hour here, so I think that would be a great place to stop here. And seeing that we're out of time for today. So I would like to thank our speakers, Tabitha Harbers, Mark Meisich-Schlager, and Mayank Shah from Accenture, and Marty Coleman from Texas Health and Human Services Commission. And I'd like to thank you as well for taking time out of your busy schedules to join us. As a reminder, links to the webinar slides and webinar recording will be emailed to all registrants and attendees in the next 1 to 2 business days. And as a reminder, there are many benefits to becoming a CAQH core participating organization. Represent your organization with others from around the industry to help CAQH core mission of creating healthcare operating rules that support standards, accelerate interoperability, and align administrative and clinical activities among providers, payers, and consumers. And with that, thank you again. Please keep in touch with us and enjoy the rest of your day. Thank you.